Hi, good morning.
Good morning.
My name is Olivia and I'm your nurse today.
Hi, my name is Gabriella. I'm a student nurse.
Can you confirm your name and date of birth?
Yeah, my name is Jen Smith and my birth date is 1/19/1958.
Would you like your family member to stay to discuss your medication?
Yeah, that's my daughter. She's okay to stay.
Hi.
Hi.
So your glucose levels were a little high. How are you feeling today?
I'm alright. I'm glad I'm getting treatment for the diabetes. I didn't even know I had it.
Is this genetic? My grandma has this.
There is a genetic component to it, but having a healthy diet and lifestyle does push the onset.
What is your typical diet?
In the morning, I usually have cereal with toast and jam, and then for lunch, I'll usually eat fast food, whatever's easiest. And then for dinner, I'll usually have pasta with meat sauce, but I snack a lot too, and I'll eat chips during the day.
It is important you add vegetables and fruits to your diet. You might want to cut down on the carbohydrates as your blood glucose levels will skyrocket.
Okay, I will.
Type 2 diabetes has a gradual onset. You'll have it for the rest of your life, so it is important that you keep it under control.
And how are ways I keep it under control?
While the doctor prescribes you a medication, we will be educating you about metformin to help manage your type 2 diabetes. Have you ever taken this medication before?
No, I've never taken it before.
Do you have any allergies?
Well, I'm allergic to cats.
Okay, just making sure you don't have any medication allergies.
So what exactly does the medication do?
We can tell you all about it. It's an anti-diabetic drug. Since you are at risk for hypoglycemia with type 2 diabetes, it is important you take this medication to stabilize your blood glucose levels.
Okay.
That sounds scary. What is hyperglycemia?
Well, hyperglycemia is when your blood glucose levels are too high, so they're above 110, and your body, since your loved one has diabetes, your body can't bring the blood glucose levels down to a normal level, which is around 70 to 110.
That's right. This drug works by inhibiting the production of glucose that our bodies make. Our bodies naturally make glucose in the liver. Also, it allows for the little insulin you have in your body to work since it makes your cells more sensitive to it.
That makes sense.
It also makes your intestines absorb less glucose from your food, so your glucose levels won't rise as much.
Do you have any kidney problems?
No.
Why would that matter?
The kidneys are responsible for filtering the medication out of the body. If there's a kidney issue, the medication can accumulate to toxic levels.
How much of the medication will I be taking?
You will be taking 500 milligram pills twice a day. You need to take them at the same time each day with your morning and evening meals.
Can I crush the pills? I can't swallow pills.
Yes, since it's the standard formula, you'll be able to crush them.
What are the side effects of this medication?
Well, some patients experience some GI upset, nausea, vomiting, diarrhea, maybe some bloating, but another side effect would be to lose some weight from the medication.
The weight loss sounds good. I don't want diarrhea though.
Taking metformin with food can help minimize the GI symptoms. Usually the symptoms go away after consistently taking the medication. However, if you are experiencing these symptoms for a while, you should contact your healthcare professional because you may be experiencing lactic acidosis.
What is lactic acidosis?
Lactic acidosis is when lactate builds up in the body and causes an acid-base imbalance of low pH in your bloodstream. It's rare though.
How will I know if I have lactic acidosis?
Well, you'll have chills, dizziness, diarrhea, muscle cramping, weakness. These are all signs of lactic acidosis, so just get help immediately.
Can she still enjoy her wine?
Yes, but in moderation, this can increase risk for lactic acidosis.
Also, since metformin can help you lose weight in the long term, if you lose too much weight too fast, it's important that you contact your healthcare provider.
Will do. What do I do if I miss a dose?
Take it as soon as you remember. If it's too close to your next dose, just wait for that dose. Don't double your dose.
Okay.
If you need to get a procedure where contrast dye is used, you must discontinue the metformin 48 hours before the procedure and 48 hours after the procedure. You can resume it after that.
Why is that?
Well, it can increase the risk for lactic acidosis and also for acute kidney failure.
Also, diet and exercise can help you manage your diabetes. I can have the diabetes educator come talk to you and explain the details.
Yeah, that would be great. Thank you.
Hyperglycemia and hypoglycemia are two conditions that occur with diabetes. There are a few signs and symptoms you should know about.
So frequent urination, hunger, thirst, these are all signs of hyperglycemia. And sweating, lightheadedness, weakness all indicate hypoglycemia.
What do I do if I'm experiencing those?
For symptomatic hyperglycemia, you should go to the hospital. You'll get fluids, electrolytes, and insulin to lower your blood glucose levels. For hypoglycemia, have something with sugar, such as orange juice or sugar cubes. You can also take sugar pills.
I hear you can pass out if you have low blood sugar.
Well, subconsciousness is possible, and if this does happen, just go to the emergency room as soon as possible.
Do you have any more questions?
Yeah, how will she follow up to make sure this medication is working? Is there a specialist we should be seeing?
Yes, following up with an endocrinologist will be necessary. You will be doing blood tests to measure how much glucose is in your blood, as well as how much glucose is bound to your hemoglobin. That's called A1C, which should be less than 6.5. But since you have diabetes, it should be less than 7.
How frequently should she be getting this A1C checked?
So every 3 months, A1Cs just to tell us how well her glucose was controlled throughout those 3 months.
One more thing, I'm on a medication for asthma. It's called albuterol. Can I take both?
Yes.
Metformin interferes with some heart medications and some antacids.
Is there anything else we can assist you with?
No, thank you.
Okay, you'll be taking this medication after discharge, which will be later today. I'll call the diabetes educator that will help with your meal planning and other important information about diabetes.
Well, thank you for all your help.
Okay, would you like to take a set of vitals to make sure she's stable?
Yeah, sure.
She can leave?